Hey guys, welcome to Pharmacy Friday Pearls. I'm Jim Pruitt. Today we're going to talk about ACE Inhibitor Induced Angioedema. This is something that we're doing a little new just to give you guys some visual. So we're going to drop this on the Pharm So Hard Podcast, but I'm also going to release this on YouTube for you guys to have a better visual of what's going on. The overall prevalence of ACE inhibitor angioedema is pretty low, less than 1%, but it does make up a good majority of the visits to the ED related to angioedema. ACE inhibitor angioedema is caused by the breakup of bradykinin, which leads to an increase in vascular permeability and release of substance P, resulting in vasodilation and fluid extravasation into the tissue. We do know that ACE inhibitor angioedema can occur at any time, but the vast majority of those cases happen within the first month. And some risk factors can include female sex, African-American race, chronic heart failure, coronary artery disease, history of smoking, and contaminant use of DPP4 inhibitors. So the cool thing is that we can look at this graph of the pathophysiology and get to see some of our major players when it comes to what can work for this bradykinin-induced angioedema. So we see that TXAX is going to be working here by preventing plasminogen from being broken down to converted into plasmin. Also, FFP can work here because it actually has the enzyme ACE, and what that's going to do is help break down bradykinin into this inactive metabolite. And lastly, icatibant is going to actually be that bradykinin 2 receptor antagonist and prevent you from having that vasodilation and swelling that comes along with ACE-induced angioedema. So we're looking at FFP. We have 2 to 4 units can be used with an onset of about 2 hours, but you always have to consider the fact that you may have to thaw out that FFP. You may not have it available, so it may take 35 to 45 minutes to actually get it to the bedside. Icatibant is going to be given at 30 milligrams sub-Q and have an onset of 2 hours. However, big thing here is going to be $4,500 for a 30 milligram syringe, and that's the average wholesale price. And we can see an onset of about 2 hours. That's going to be more available in different places compared to some of the other agents. So that may be the first thing that you have access to related to ACE-induced angioedema. So let's look at some of the studies regarding these agents, and you would not be blown away, I promise you guys. The first study that was done by Bass and colleagues in 2015 was an RCT with 27 patients, and it looked at icatibant compared to prednisolone and simvastatin. And what they saw was that when it came to time to complete symptom resolution, it was 8 hours compared to 27 hours when looking at icatibant. And the time to onset of symptom relief was 2 hours compared to 11 hours when comparing icatibant to prednisolone. And all patients had experienced complete resolution of edema. But when we looked at some of the other studies, that didn't carry on. So Stryker and colleagues in 2017 did an RCT of 33 patients that looked at icatibant versus placebo. And the time to resolution was no difference between the two. And the amount of swelling over time was also no difference between icatibant versus placebo. So that was a huge knock for me when it came to using one of these agents, because I expected it to work really well, and I expected it to work very well compared to placebo. The final nail in the coffin was this last study that looked at 121 patients that received icatibant versus placebo, and there was no difference in time to meeting discharge criteria between the two groups. So overall, for me, I won't spend $4,500 for something that doesn't work better than placebo. So let's move on to FFP. And you guys will be thoroughly impressed with the fact that it's only case reports and case series. Not much data here, not very much strength of data. We have like a total of 12 patients in all of these studies. But what they found was that anywhere from 2 to 4 units of FFP led to pretty decent improvements in symptom resolution when it came to patients that presented with ACE-induced angioedema. The first one is said that they got extubated within 2 hours following FFP administration. So I think it's pretty interesting. The one case series showed a temporal association between FFP and improvement angioedema in all 7 cases. So I think it's something that should be studied a little bit more than 12 patients, but it's definitely theory generalizing, and we should look at this a lot more. And if you have nothing else and you want to use something, this may be an option if you're comfortable with the side effect profile of it. And lastly, TXA. This first study was a case series of 33 patients, and what they found was that 81% of patients had achieved improvements in their symptoms with TXA. And more importantly, close to 40% of patients actually had symptom improvement within 1 hour. That's the biggest thing that we had, and I thought that was pretty interesting when it came to that. And there was one case report that also showed that once given 1 gram of TXA, you had improvement in speech observed at 30 minutes and complete resolution of symptoms at 2 hours. So thought that was very interesting. And this last case series here didn't do too much for me, but it showed that the median length of stay in the hospital was 1.2 days, and there's no adverse effects related to medication administration of TXA. So I thought this was a pretty interesting topic. And overall supportive therapy should be first for these people. If they need to be tubed, you can go ahead and do that. But if you have time, since this is more of a gradual swelling, you may be able to use 6A, which would be my go-to, or FFP if you are completely against using TXA. And the nail is in the coffin for a candidate for me. So this is another episode of your Pharmacy Friday Pearl. You can definitely check this out here. Go to the website and subscribe to our email list at Pharmacy Friday Pearls at pharmacyfriday.com. And for the podcast listeners, please subscribe to our podcast on Apple Podcasts and Spotify. So thank you guys and have a good day.